So the addition of Everolimus or Afinitor into the endocrine therapy combination strategy is going to be very important. We're already seeing uptake in the clinic. There's also a lot of enthusiasm because other molecules with that as a target are being studied in a variety of trials, and so there is a lot of enthusiasm and awareness around the combination. I think that for patients that are on an aromatase inhibitor that have plodding along disease, slowly progressing disease, short of a visceral crisis or don't have a bulk of disease in the liver, lung, or other visceral organs, I think that's going to be the go-to therapy for many of our oncologists. We're going to start out with it being used in second, third, fourth line setting, and then see it gradually move forward based on the results of trials and how well tolerated and effective it is in the clinic. So the primary toxicity I think that's been troublesome has been the stomatitis. The toxicities of the diarrhea, the rash, the glucose issues have been sporadic and fairly easy to manage with supportive care. The stomatitis is a little harder, mouth ulcers, and I differentiate that from mucositis because the patients aren't often getting the stomatitis or mouth ulcers in combination with diarrhea. So oral preparations, some of the topical solutions, the magic mouthwashes and the like that the nurses use have been effective. But I found that in patients that get substantial stomatitis, the first move is to simply take a break from the therapy. A washout period of 3 to 7 days is very, very effective. And then a decision to be made to re-challenge at that dose or drop from 10 back to 5 milligrams has been very effective. So the oncology nurse in my practice, and I think in the Sarah Cannon practice in general, is the key to this. The nurses do most of the education and most of the walking with the patient out through the therapy, and actually the nurses drive that from the very beginning. They're the ones that are staying in touch with the patients and managing it. There's grades of severity and how troublesome it is for the patients, and our nurses are the key parts of that, making sure that the downstream effects, losing weight or not eating or drinking appropriately, aren't caused by the stomatitis or other issues. So the oncology nurses are key to this.